So in that article, which is a very recent one, they mentioned the cryosurgery as focal therapy, they mentioned the HIFU, which I'll say a few words, and also the photodynamic therapy. So the focal HIFU, we are very fortunate because we have also on our video blog a whole lecture with Dr. Douglas Chin, who talks about the same issue. If you want to learn more about HIFU, you could get on clinicaltrials.gov and see what studies are still ongoing that you could maybe join. But I'm aware at least of one study that already finished and we are waiting for the results. So let's go now to the issue of HIFU. HIFU is not approved in the United States. That's why it's very, very expensive. Contrary to cryosurgery, cryosurgery is paid by insurance. HIFU is not paid by insurance. And you have to leave the country. And it's quite expensive, the treatment itself and the travel. So the HIFU, there is an ongoing study that just started right now in May in the University College of London, where they, interestingly enough, take patients that are candidates for active surveillance. And they divide them into two groups. One group will get the active surveillance, the other group will get the focal therapy. Very interesting because the criteria are you have to have low-risk disease for the focal therapy or for the active surveillance. Actually, some people oppose the focal therapy by saying, what do you need focal therapy? The same group of patients could be on active surveillance. Well, it's not so because many patients do not feel comfortable being on active surveillance and they want something to be done, but they do not want to move to the radical treatments. So the focal therapy for them is like the middle of the road, sort of speaking, and they want to do focal therapy. And then there are patients that are in that nagging grade, Gleason score 7, the 4+3 or the 3+4, which they don't feel comfortable or not accepted in active surveillance program. They could still join places where they will do the focal cryotherapy on or focal HIFU on patient with Gleason 7. Interestingly enough, focal cryotherapy also can be done on people not only with localized disease, they could be done on failure of radiation, on failure of cryo, or failure of HIFU or other treatments. You could still do focal treatment as a salvage treatment. But we are focusing today not on the salvage treatment, but on focal therapy for localized disease. So we mentioned the HIFU. The third technology is the photodynamic therapy. They are starting a study now in the University College of London where they use photodynamic therapy, MRI guided studies, and it's very interesting. So we see the trend is to try to use focal therapy together with better imaging. And in the article that I mentioned, that I think it's a good idea for all of you to read, they mentioned the multi-parametric MRI as a good tool to monitor the treatment, but also to be a benchmark to follow up the success of the treatment. Interesting to note that there are other methods of focal therapy. There is a company in Houston that they start doing studies where they use MRI-guided laser. Instead of using the photodynamic therapy, they use just plain laser. And I even came across some treatments that are tried of trying to inject certain materials in the prostate. So we see that the focal therapy has come a long way from the days that we treated the whole organ and caused the side effects. So it's a middle of the road, the focal therapies, to try to give you a treatment that you feel better because you destroy the cancer. Interesting in the evolvement of this approach is the fact that in the beginning they start doing only 1/2 of the gland, which I myself did it many years ago. Then they moved to try to treat only areas that they see on the imaging. And now even there is a trend to go to what we call the index tumor. Dr. Barentz talks about it a lot. The imaging improved, and he talks about the index tumor. That puts a bit to rest or sharpens the argument with people that say, wait a second, prostate cancer is actually multifocal. And if you treat only one area, what will happen with time with the other areas? Well, that's why we need good tools for follow-up, either by PSA kinetics, rise, doubling time, velocity, or by markers, changing markers that I like to do for my patient that get coaching with me, markers that could tell you beyond the PSA how aggressive is your tumor or if there is any trend. And that's why we do all these imaging tests to try to follow up the patient and see when is it time to move to a more aggressive treatment instead of the treatment done at the moment. So I think we all have to be very hopeful of a very good solution to the issue that we find too many cancers. I'm not saying that every patient with elevated PSA needs a biopsy, and not every patient with a biopsy needs to have a treatment. So we need to refine and modify our behavior. But first we need to find who are those people that are candidates to get into trouble, and then sort out those that we need to treat. Because on one side we say over-treatment, but on the other side we have a problem with sampling error, and by defining less aggressive disease, we have a problem there because we may miss other cancer that we have to find out. So there is a lot of work done. We could all be very optimistic. I think that sometimes it takes a coach to go through the fine points of the decision, what to do, how to do, where to go, who should do the cryo, who should do the HIFU, who should do the photodynamic therapy. And for that, that's necessary sometimes to go to a coach who is not biased and that has the time to make the right communication with the people that could do it for you. So stay well, stay informed. If you have any question, don't hesitate calling us at 619-906-4700. That's the general phone number of our foundation. Or call the Ask Dr. Barkan call-in show, which is an audio call-in show every Tuesday at 6 p.m. Pacific time. And you could download the show if you missed it by going to our website, www.pcref.org. Or you could go to our video blog and try to leave a question there, and you could send us an email by writing to info, @pcref.org. Stay well, stay informed, and have fun. Goodbye.